Hi everyone, my name is Hannah Himes. I am an MSN Education student and I'm happy to be presenting to you all on pneumothoraces today. So we probably all encountered this a little bit in our nursing practice, but we're just going to take a little bit deeper dive today. So of course, first, what is a pneumothorax? This is just a disturbance in the pressure gradients that already exist within your thoracic cavity. So specifically, this is an accumulation of atmospheric air in your pleural space between your pleural lining and your visceral lining. This extra atmospheric air shouldn't exist there, doesn't in normal people. But once we have an injury or other sources, which we'll look at, we can have this accumulation of air. It increases the intrathoracic pressure compared to a normal person, and it decreases our vital capacity, which means it decreases our ability to expand that lung and participate in optimal oxygenation and ventilation. So what do we normally see on a patient with a pneumothorax? You're going to see all these things: anxiety and restlessness because they're not being able to oxygenate like normal, respiratory distress, which can look like tachypnea and dyspnea, tachycardia, of course, hypotension in some situations. If it's an open pneumothorax, which we're going to look at the types, you may hear a sucking sound. And if you're with any of the types, you're going to hear diminished lung sounds or breath sounds on that affected side. But the tension pneumothorax may see a deviated trachea, which we'll talk about. And if the hypoxia is severe enough, some cyanosis. Here are the types of pneumothoraces, which we're going to talk about each one. Closed is the first one, open pneumothorax is the second, and tension pneumothorax is the third. Closed or simple pneumothorax. You may or may not actually need treatment for this. Sometimes it's just a tiny apical pneumothorax up here in the corner, and it may resolve on its own with just some time and maybe some supplemental oxygen. Chest tube may be indicated if it's severe enough. With an open or complex pneumothorax, this is where air can enter in and out. This is that type where you may hear a sucking sound or a sucking chest wound, some people call this. You may also see some accompanying subcutaneous emphysema with this type of pneumothorax, which is when you can feel those Rice Krispies underneath the skin. That's fairly normal for this type. You may hear people say that you need to do a 3-sided dressing for this type of pneumothorax. This is kind of generally outside of the hospital setting, but it's a good temporary fix if the chest tube falls out, something like that. Again, chest tube, definitive treatment. Lastly, we're going to talk about tension pneumothorax. This is the most dangerous by far. This is where air is allowed into that pleural space, but not out. So as that progresses and as the person is breathing, inspiring more and more, that trachea is going to deviate to the unaffected side in an attempt to still oxygenate and survive, of course. This is commonly caused by blunt traumatic injury, like a stabbing, for example. And then of course, the definitive treatment is still the chest tube, but a needle decompression can be performed for a temporary time saving or buying you a little bit of time for these kind of patients. And either of the spaces listed below, of course, performed by an MD. Hemothorax related, not technically a pneumothorax, pneumo air, hemo blood. So this is a blood accumulation in that pleural space. So the same space, similar assessment findings, and again, a chest tube is needed for this. Causes of pneumothoraces, we've talked about some trauma, blunt or penetrating trauma, some rib fractures, diving or flying, of course, adjusting someone's pressure. Barotrauma like ventilation, or spontaneous pneumothoraces can occur, especially in people who are tall and thin, who have a family history of this, or who have a history of smoking. Diagnosis, of course, is a chest x-ray, but we don't want to delay treatment just because we're waiting on a chest x-ray if we're convinced this is probably what's going on. Of course, definitive treatment, as we have said, is chest tube. Needle decompression can be temporary to buy us some time, and oxygen therapy. Questions? What are some causes of pneumothorax, and what is the definitive treatment for pneumothorax? These are my references. Thank you so much for listening.